What's up, everybody? This is Dr. Zach Baker with the Strength and Knowledge podcast, and I have on with me today a special guest, Dr. Shelbie Miller, out of the great state of Texas. And Shelbie, we have been kind of informally have known each other for several years now, and it's been a lot of fun watching you grow within the profession, seeing all of the different connections and networks that you've gotten yourself established within, and really just a genuine appreciation for how you go about patient care and interacting not only with your patients, but also other professionals within the field. So I appreciate you taking the time to come on as a guest today.
Well, I'm grateful to be here. It's an honor to do anything related to Rehab to Perform. So thanks for having me on. And to your point, yeah, it's been great getting to know you over the years, and you've been certainly an internet mentor over the years.
Awesome. Well, I did a kind of a brief introduction, but for those who are unfamiliar with you or haven't had the chance to speak with you, do you mind giving a little bit of background of just kind of who you are, where you're from, and then we'll tackle the cliche question of how did you get into physical therapy?
Love it. Absolutely. Yeah, so I was born and raised in Fort Worth, Texas. I kind of knew from like eighth grade that I wanted to go into physical therapy. I broke my thumb playing softball. I tried to like lay down a bunt, took a ball to the thumb, broke my thumb, ended up in a PT clinic that also had like an OT clinic, and had to get like my thumb splinted. So I was only there for like a day, but it was just an introduction to the field of PT where I started to essentially kind of realize I could get paid to work with people and be around sports. And it just seemed like there was a lot of opportunities there. And so from kind of eighth grade on, I just really pursued that. So in high school, worked as a PT tech and shouted at a few clinics. And then same thing through like undergrad, did pre-PT track. And then when I was home in the summers was, shadowing and just doing all the things there. And then applied to PT school, only got into one, got waitlisted at that one because my GPA wasn't super great. So went to Hardin-Simmons, graduated there at the end of 2017, and then took a job at Texas Health Sports Medicine where I did my final rotation as a student. And it's been where I've been for the last 5, almost 6 years, coming up in February. We're in hospital-based outpatient clinic, have a residency in-house, have a research lab in-house. So very, very spoiled. It's a job that I felt like I could take and almost create kind of a pseudo residency for myself and get a lot of the same experience that I would through a residency without actually going through one. So I kind of bet on that and took the job and have been really pleased with so far how things have unfolded for me.
No, that's awesome. I think the one thing I will point out, though, the difference between you and I, if I ever get the bunt sign, I'm just acting like I never saw it and I'm still swinging for the fences anyways.
For sure.
So you kind of led into where I wanted to go with my next question in this part of the conversation with regards to your current place of employment. You've been there for a little bit of time now. Do you mind elaborating on, it seems like a pretty unique setup that you have there. What types of roles and responsibilities do you have outside of patient care, whether that's formal, informal? What other opportunities do you have beyond just treating patients?
Yeah, for sure. I think obviously my bias lies in, not all outpatient clinics are created the same. And I think you would agree with me on that. Definitely sensitive to the fact that there's a lot of really bad outpatient clinics out there and a lot of mills and a lot of companies that are running their employees into the ground and seeing a ton of patients, and the care is, not super great. I think working in a place that is supported by a big hospital system has a few benefits that I tend to bring up to students and new grads. I would say just access to resources and support has been huge. So having access to a biodex and force plates, and we have a biomechanist on staff. We're very, very spoiled in that regard. And so if there's data that I need, I can just ask our biomechanist to run them through whatever I want, really, and then get the report. So that'd be like one thing, is just access to resources is bigger and better because there's just more money compared to like a private clinic. I would say the other thing is just like pay. Again, being a part of a hospital system, you're going to get paid more than being in a private clinic, again, just because there's more resources. And so I feel very fairly compensated for what I do, which is a really nice place to be. It's good to feel content in your job. Certainly not complacent, but at least content financially. And I feel like they've been very generous towards me over the past 5 years. As far as like other roles and responsibilities, outside of patient care, from a patient care standpoint, we, are probably similar to you guys in that we see a good mix of post-op, non-op, see a ton of high school kids, handful of college, and very small number of like elite and pro. So predominantly high school kids, which is really fun. Have a great relationship with the athletic trainers that we work with. A lot of us at the clinic tend to do a lot of sideline coverage, which I think is really special. I think to connect to athletic trainers and get to just get in their world and really see things from their eyes and really demonstrate that you actually want to learn from them is super important. I think it's been my experience that a lot of athletic training friends feel like PTs try to come in and either do their job or judge them for what they're doing. And there's just not enough collaboration there. So that's kind of the patient care side. And then the other stuff that I do, I'm like our clinic site coordinator for education. So I help, place students at our South Arlington clinic. We just opened an East Arlington clinic that's kind of south of Dallas, Duncanville, DeSoto area. So starting to push students out there as well. Also just started our it's called I don't know what it's called, social media champion or something, some fancy hospital term, but essentially just I'm now responsible for trying to get content on the internet. Now, being with the hospital, there's a ton of red tape. I wish it was as easy as what it seems like it is for you guys, where you can video and take pictures and then just put it immediately on your social media however you want. There's a lot more red tape on our end.
When they let me be the face and the voice of certain things within the company, we have pretty low standards and barriers to entry.
No, I love it. I really do wish it was that easy. It's just not. So, we have to post it to like Facebook, and it has to be, there's just a lot of rules to it. And it has to be very, like patient facing. And so there's like certain like educational things that I would love to like share, but the hospital doesn't really see it that way. So just kind of learning that role. It's a new thing. They don't even have an Instagram, which is my preferred platform from like a visual standpoint. So yeah, kind of dabble in that a little bit. And then, yeah, really outside of that, kind of an informal residency mentor that will become more formal here probably fairly soon. And then I also teach didactic with the residency. They're like sports performance lectures, one that I've done the past few years. So yeah, I feel like I've gotten like my hands kind of in a lot of things. If I wanted to write a research paper, I could. We have a ton of data that's just kind of sitting there that any of us in the clinic, if we want to write, we're encouraged to. I started it and then I just haven't got back to it. So yeah, that's a little bit about what I do.
No, that's awesome. And I want to touch on a few of those things a little bit later on because I had a couple questions I wanted to talk to you about, career aspirations and different things that you have done to keep your passion and keep your enthusiasm. And I think some of the things I just heard you talk about are great ways to do that. And finding ways to expand your clinical influence beyond patient care is something that often drives people and kind of gives them that rekindled energy within their career. A few things that you had mentioned, if we have anybody that is entertaining, job opportunities, you're a PT student, you're a new grad, you had elicited or you had alluded to being in a big hospital system. You're in a big hospital system. I'm in what used to be a small private practice is now a growing private practice, but we're still not, we're not as large as an ATI or a Pivot or any of those other practices that are out there. But keep in mind, there are going to be pros and cons to every job offer and every job situation that you see. There are some extremely unique benefits to being in a hospital system. There's some extremely unique benefits to being in a private practice. Just make sure if you're looking at jobs, get a very good idea for what your day-to-day is going to look like. What do those compensation packages consist of as well? And don't get hung up on just what a salary is. look at what some of the other benefits and perks are. And I really think that's where the larger organizations do have the hand up in that with regards to what they can provide with some of those secondary benefits beyond just what you're getting monetarily paid as well. But Shelbie, do you mind touching a little bit on, you come into the career with kind of a certain idea of what you think your career is going to unfold like. And then as you get some experience, as you get some reps, sometimes that vision changes. And sometimes your situation, your ideals, your values change. Has that happened to you? Have you kind of stayed true to course with what you envisioned your career going at? How has that evolved over the last several years?
Yeah, no, I love this question. I think it kind of alludes to the ideas of like goal setting, which is something that I feel like I've really like struggled with and like wrestled with. I think on a personal level, I'm just not someone that tends to like, I'm just not a good like long-term goal person. Like I'm very much like, what do I want to do this next year? And beyond that, I don't really have much vision. So I know that that's probably more rare than not. And so I would say when I like got into PT school, I just knew like I want to go into sports. And for me, that there was no like defined like end goal of I want to be, working in a D1 program, or I want to be a rehab coordinator for a pro team, or there was none of that. It was really just I want to work in sports, and I don't really know what that's going to look like, but I just want to work in an environment where people are excited to do what they do, that they want to do that with excellence, that I'm being pushed and grown in that culture, and then that I'm being equipped for like future opportunities. And so kind of felt like, the past 5 years, haven't quite outgrown where I am. I would say like in the future, I have a better idea than I used to. I think what Tommy Otley does with Miami's a pretty awesome gig, getting to be a PT for a D1 women's and men's college basketball team. I think I would super, super enjoy that. Like there's some barriers there just as a single person with a dog, like travel schedule is just tough. So I have to keep that in mind. But yeah, trying to do things now that might prepare me for opportunities, similar to that in the future. So yeah, it's not super exciting because I didn't have like this big aspiration other than like, I just want to be in sports. And I'm very open-handed with that. So yeah.
No, and I think that's important to hear because I think we're all led to believe that we need to have this kind of light at the end of the tunnel. We need to find that pot of gold at the end of the rainbow with regards to where our career is going to take us. And oftentimes you just don't know what that is. It's funny. I heard a term, it was actually in a financial podcast I was listening to where they mentioned just being directionally correct. And it doesn't have to be absolute. It doesn't have to be perfect, but you always need to be trending in the right direction or what your intended direction was. And you often don't know what that end goal is until you at least just start taking some steps in that direction. And I'm very similar to you in the sense of, I think earlier in my career, probably in PT school, I always had the dream of working in college or pro sports, but admittedly, I didn't even know what that looked like. I didn't know what you had to do to get there. I didn't know what opportunities there were. I just knew I liked PT, I liked sports. College and pro sports are kind of at the top, so that would be a cool place to get to. And then I've had the opportunity to work with professional athletes. I've had the opportunity to work with collegiate athletes. We've seen some Olympic athletes. This is through our private practice, not through any formal affiliation. And I started to realize, there's differences in regards to the settings that you're at, and you can see the types of individuals you want in a variety of settings. You can fully immerse yourself into these different niche categories, but there's a give and take with everything. And I've got some great friends and colleagues who have worked their way into college and pro sports, and there are certain things that they love about their job, and there are certain things that are different, but unfortunately they just cannot change them. And some of that has to do with the schedule. Some of that may have to do with how much autonomy you have just because you're part of a very large and competent group. And you have strength conditioning staff, you have physicians, you have nutritionists, you have massage therapists, you have ATCs. So your roles get a little bit more delineated, whereas if you don't have that, you may get to wear a few more hats. Now, wearing a few more hats is great, but it may also mean that you never really get to truly specialize under any one of those hats. So I think anybody who is entertaining the idea of going a specific route, and whether that's owning your own business, working just as a member of a team at a outpatient clinic, working in college or pro sports, talk with others who have been there and get an actual idea of them, of what a day in the life and a week looks like, what they enjoy, what was kind of a struggle or a challenge for them, because it's something that you don't know what you don't know. And until you get that information, you are kind of walking blindly. Now, Shelbie, you are extremely busy with stuff that you're doing at work, but I also know that you're very involved with things outside of your 40-hour-a-week work week. What are some other side projects or just other communities or networks that you found yourself getting involved in, either just to fulfill your either personal or professional aspirations?
Yeah, I think, over the past few years, that's looked different. And so, back in 2018, I first went through like the Level Up initiatives, like mentorship, had a really great experience, and then was like a mentor with them for, I don't know, like 3 or 4 cohorts after that. And then just kind of maintain that relationship with Zach and Steph, and wanted to be, helpful where I could. And so helped whenever we were doing the CALU annual virtual summit, helped plan that on the back end, helped get like speakers and kind of coordinating all of that. During the monthly mentorship that Level Up was doing, used to help with like grouping students and new grads with mentors, and then running like a mentor orientation call. So I say all that to say my role with CALU has evolved over the years, but I've just maintained those relationships because it's something that I really value. I think they're people that are similar to you guys at R2P that are on a mission to just change healthcare for the better, for sure. And so currently that looks like very informally being a mentor in like their CALU circle community, but hoping in the future for some more like in-person stuff. I'm not really sure what that's going to look like yet, but that's kind of my plan there. They also support the podcast that I host called the Rethinking Rehab podcast. So huge thanks to them for supporting that. I kind of pitched just an idea to Zach right. It was either like before or after CSM last year. I think it was right before. Of like, hey, like, man, something that like really gets me fired up is going to CSM and like hearing these people that have been out for 10, 15, 20 years. And they're telling me like, I used to practice like this, and now I practice like this. And this is how kind of I changed my mind on X, Y, and Z. I think for me as a younger clinician, those conversations really just like freed me up to like not have everything figured out, of like, oh, okay, like I'm supposed to be changing my mind and supposed to be fumbling and figuring things out. That is a normal part of the process. And so that was kind of the initial kind of heartbeat behind the podcast. Pitch it to Zach. He was kind of like, I think that's a really cool thing. So kind of set me up for success and took all the barriers away. So like had a mic, had someone do all the production. He was like, we'll sponsor it. We'll take care of all the, not like the admin stuff, but the not fun stuff when you record a podcast. So really my role is just to hop on a Zoom call with someone, have the chat, and then everything else pretty much gets taken care of, which is really fun. So do that. And then, I guess like another part of like Rethinking Rehab, is like a monthly newsletter. And really for me, that kind of served a few purposes. It kind of just captures everything that I was already doing. Like I already try to stay on top of research. And for me, getting to like take research articles and then try to put that in my own words and put that in a form that hopefully adds value to someone else and gives back to the profession, was something that was important to me. So use that, one, to kind of force me to stay on top of the research and to be able to work on just communicating research into practice. And then I would say lastly, it just also serves as a little bit of extra money on the side, which I think is nice as a PT to have a little bit of extra cushion. So I do that. I was also involved in like starting the casual chats with the Academy of Sports Medicine, or the ASPT. Um, so it was in charge of like getting speakers and kind of doing back end stuff with that for probably like 2 years, and then passed the torch off to Sarah Anderson. I think now those are on pause due to some like Academy stuff, but helped kind of get that up off the ground. And then Evolution Ed does a monthly like roundtable discussion called Clinical Roundtable, where they have kind of a monthly topic, and then someone there facilitating discussion. Really just meant to be an extra type of like mentorship to people, or like, hey, bringing, I have this case, I don't really know what to do. Well, now you have 10 to 20 people to kind of bounce ideas off of, and so was kind of the first like moderator or like leader with that. Did that for I think close to a year. Stepped away from it. So I really recently just kind of stepped away from a lot of things that I was doing, because I just felt like I bit off more than I could chew. And I want to sustain in this profession and not be burned out. So I really pulled back and just tried to invest in the podcast and my newsletter, and then really just trying to do the job that I have currently well. Did a retreat this year as well, built like a website. So I just feel like I put a lot of energy towards trying to get Rethinking Rehab up, and I just still don't know what that's going to look like in the future. But just trying to try things and letting kind of my creativity try to come to life a little bit. And for me, that's what keeps me engaged in work and excited about work. And it's what fills me up from a work standpoint. Obviously, there's things outside of work that fill me up. Work is not my entire life, but I do enjoy engaging my brain outside of work, so that inside of work, I can do my job well and engage in conversation, hopefully in a way that's helpful to my other colleagues. But yeah, I think that's most of it.
No, and that's awesome. And I think the big picture that I got from that is you have been around a variety of different people that have a lot to offer within the profession. And whether that's from a research standpoint, whether that's from a clinical education standpoint or patient care, whether that's, you had alluded to, you've been in multiple situations where you've started things from the ground up, whether it's a podcast, whether it was some of the different roundtable discussions. And I think that's getting out of your comfort zone a little bit, where you get to see some of the behind the scenes logistical work in play. And I think there are a lot of times that we complain about things in our profession. Hey, why don't we do this a certain way? Or why do we have to do this? And until you're actually on the ground level, putting in all the behind the scenes work of getting a roundtable discussion started, or getting a podcast started, or trying to do mentorship, or being involved with teaching within a residency, you don't even appreciate what some of those logistical barriers are, and why sometimes it does take such a long time for processes to change, or standards to change, or different thoughts to change. So I think that's some of the most valuable things that I have found within my career, kind of going out of my day-to-day routine of what used to be just a staff PT, and getting involved in the different realms. And I'm sure you have crossed that bridge as well. And then the other, I think one of the most important things that I will take away from what you just mentioned was, it is okay to say no to certain things. Yeah. And I'm guilty. I'm a people pleaser. I will say yes to everything until I realize I am in 10 feet of water and am struggling to stay afloat. And that's something that I've been trying to get better in my career, which kind of goes full circle back to what you had talked about with goal setting and having a hard time figuring out what your goals are. I'm the same way, where it's hard to really project out too far into the future. So I just kind of cast a big net, go a variety of different directions, and see which one's pulling me the hardest. And the ones that are no longer enjoyable to do, or the ones that I feel like I've just personally kind of hit my ceiling of what I can contribute, and I think it would be a great opportunity for somebody else to step in and take over, whether it be somebody who is looking for the experience and they just haven't had it yet. Maybe it's a former student of mine or a colleague, or just somebody that has more to offer than what I can, and I can just tag out and say, hey, let's bring this person in. That's been one of the most refreshing things in my career, is getting to a point where you do understand it's okay and it's appropriate to say no and not try to do everything. And I think it's very easy to get caught up in the kind of the hustle and bustle of trying to go 100 miles an hour and doing everything you possibly can inside and outside of work. And sometimes you just need to let work be off to the side and do your own thing, or just focus on the stuff that's most meaningful to you with work.
Yeah, no, I think that's super important. Even to the people, right, that we're working with, right? If there's things that we're saying yes to that we really want to say no to, that's really not fair to the other person involved as well.
Absolutely. And that's where just understanding what your own bandwidth is from a contribution standpoint. Switching gears a little bit, going back to kind of more the topic of PT school, going through PT school, what was one of the most biggest surprises or biggest challenges for you? And what advice would you have for those that are preparing for or are currently in PT school?
Man, I went into PT school with literally no expectations, because I started in 2015, so it was kind of right on the cusp of, or right at the beginning of like social media and PT. So like when I started school, from what I can remember, like social media was really not a thing as far as like PT world is related. And so I went into PT school very oblivious. Like I didn't understand that we were learning things that were, relatively outdated, and that there's certain things that we had to be taught. And I went in ignorant, which was kind of nice, honestly. I would kind of rather do that than go in knowing what I know now and just be like frustrated every single day of class. And so I think the hardest part of school wasn't necessarily the mismatch of what I was learning and what I was seeing on social media, where I think that would be my struggle today, and probably what most students, at least ones that are on social media, probably struggle with. I think just like the workload. I mean, I went to a program that was 28 months, and so we were in class 8 to 5, and then you would run home to get your dinner and then be studying from 6 to 10, 11, or 12, and you just rinse and repeat every single day, except for maybe 1 or 2 days during the week to catch up on other stuff. And so I think that was just, like a wake-up call, like, oh man, that's my first semester of PT school, and it's midterms, and I have 14 tests and lab practicals that I have to study for. How do you prioritize, which one to give your energy to and your attention to? And I think if there was, anything in PT school that I had to learn, it was just that, like, there was no way that I was going to learn 100% of things 100% well. And so I kind of just chose the things that I knew that were relevant and things that I actually cared about post PT school, and really tried to pour energy into that. Everything else, it was very much going through the motions, just memorizing it for the test and then dumping it once I was done. And that might not be a good strategy for other people. But I think just knowing that I wanted to go into sports coming into PT school, that just freed me up to not pay super close attention to other things that were not like directly related to that.
Yeah, so. I would agree. And that was the biggest surprise for me. And I'm by no means the most intelligent person. I think my wife and my friends and a lot of my colleagues will tell you that as well. But growing up, like high school, undergrad, I was the type of person that could just attend class and just sit and listen, and I would be fine. Yeah, I really wouldn't have to prep for lectures. I wouldn't have to go home and study. I just needed to be present and engaged. And I'll tell you, I had a pretty big wake-up call when I took my first anatomy class, my first anatomy exam at University of Maryland, and realized that I was putting in like a 12th grade effort for something that was a graduate school program. And it was pretty humbling. And then after that, got my head on straight, became a little bit more structured, just a little bit more diligent. And I think the biggest advice that I would give to people, like you had mentioned, is you're not going to know everything. So what you need to do is you need to figure out, what are you comfortable with? What are you good at? And then the stuff that you do not think you can handle or you do not have a strategy for, don't be afraid to ask for help. I think
Right.
one of the most comforting things was one of my professors at Maryland, our first week, told a story about how he almost failed out of school during anatomy just because he was so overwhelmed with the amount of information. And he had been there forever. He has done phenomenal things within the PT career or PT field and PT community. He's one of the most well-respected people at University of Maryland, just with how students looked up to him and his ability to be open and help. And just hearing that from somebody else going through those same struggles that we were about to go through kind of put things in perspective of, hey, you don't have to be embarrassed. Like there's nothing to be embarrassed about. There's nothing to be ashamed about. But just make sure that if you do need help, go seek that out. So, Shelbie,
Absolutely.
I appreciate you taking the time to come on here. For those who were not familiar with you leading up to today, what is the best way for them either to stay connected with you or reach out to you if they want to pick your brain just on any of the unique experiences you've had, or just keep track with what all the cool things you're doing down in Texas?
Yeah, Instagram's probably the easiest. You can just shoot me a DM and I'll give you my number. We can hop on a call. But handles Rethinking Rehab, no spaces, all lowercase. That's probably the easiest way.
Awesome. And if anybody has not listened to Rethinking Rehab podcast, it's good. I know we have several people at R2P that regularly listen in on that. So I'm sure they're going to be very excited to hear that we were able to steal you away for an episode to pick your brain on here. So Shelbie, always great catching up with you. Best wishes with everything moving forward. And hopefully we can connect to CSM this year.
Absolutely, Zach. Thank you so much for having me on. I appreciate it.
Absolutely.